Hi, Doc.
Hi, Dave. I hope you can really help me out. I used to be on steroids for 20 years, stopped 2 years ago. Ever since I have stopped, I have no sex drive whatsoever, can't get hard at all. Most of my courses have been between 750 to 1200 milligrams of test a week on my courses. I never did PCT, used to come off between 4 to 6 weeks, then back on. I'm sorry, there's no punctuation on this whatsoever, so I'm sorry I'm butchering this. I've seen few doctors now and endocrinologists. I was but on Clomid and Arimidex, still no drive. Also have done HCG, no luck still. My doc did try TRT. I felt no better. Said my receptors have desensitized. I've been told it's not receptors. I've also been told my body has got used to high levels of testosterone. He's asking questions. That's why I'm giving
Yeah.
inflection. I don't know what to do. I don't seem to be getting any help with the doctors. All my bloods are good. My testosterone, 26 nanomoles. That's 761 nanograms per deciliter. FSH, 8.5, LH 6.5, estradiol 55, SHBG 64, prolactin 228, progesterone 1. I've had no more bloods done in the past. Everything is in range. Why do I have no sex drive? Just can't turn it on. And any help would be great to hear soon. Regards, Mark. Okay, so again, I have a little bit of a problem with the numbers because, if it's, again, picograms per milliliter of estradiol, boom, we got a problem right there because you're at least 3 to 4 times optimum there. I don't care what the normal ranges are. We've talked about this. It's not even close to optimum. When estrogen's high, it can totally ruin your, everyone's different the way it works. Some people, I see their sex drive go through the roof with extra estrogen. Some people, it buries their sex drive. Some people have too low an estradiol and they can't get an erection. Some people, it makes it, a big difference to have it, no pun intended, somewhere, in between there. So prolactin 228 does not sound like a normal range. He says it's in range. Again, maybe it's because the numbers don't jive with the US numbers I'm used to seeing, but I'm trying to imagine what that could be. Again, but 761 nanograms per deciliter, that doesn't impress me. Because yes, the range, depending on what lab he's using in his country, here it's 250 to 1200, let's say, with LabCorp. We've known since the 1960s, and they used to use total, so we're going to use total here, that in replacement dosages, 800 nanograms per deciliter or above must be achieved to see clinical benefit. Forget about the numbers again. Now we're talking about replacement therapy, whether you've been on steroids forever or not, or whether you're just a guy that's hypogonadal that needs replacement. We've known since the 60s. One of this is not a plug for my website because my website's old and it's going to get replaced, but I have an article on there from the 60s that states just that. It is a matter of fact. We've gone through this before. So yeah, it sounds like there's a few things going on. One, we got to get your estradiol down because it's way too high. Like I say, 3 to 4 times where it should be. 2, that level of testosterone ain't cutting the mustard. Okay, by what we know. Again, everyone's different, so I'm just talking by the numbers here. The other thing is, being on or off PCT, really, the only comment I have about that is, you want to get your levels of testosterone back up real quick? Forget about PCT.
Super.
Your body's going to go, holy smokes, where'd the testosterone go? And you're going to have a strong signal sent through the pituitary saying, where's the testosterone? The Leydig cells are going to get lit up, spanked, like there's no tomorrow, and that's the most efficient, if you will, or most effective, however you want to put it, way of getting them straight on back online. The reason for using HCG or any sort of post-cycle therapy is usually twofold. One, you want to make sure there's no extra estrogen, which if there's no testosterone, there won't be any extra estrogen. But just in case your body starts to come back, and because you've had such a high level of testosterone, whatever testosterone you make is getting converted to estrogen, then you want to keep that down. But the other reason is I call the testicles diesel engines. takes a while to get those puppies fired back up again. So you want to, leading into stopping whatever you're doing, if you're stopping because you want to get pregnant, you know, again, I'm dealing with people that are on hormone replacement therapy, you know, quote unquote, legitimately, as opposed to just bodybuilders that want to do it. But it's the same principle, okay? You're coming off, start getting those testicles going again. I refer to the pituitary as a gas engine. As soon as it needs to turn on, man, it turns on and sends a signal. But your testicles are going, whoa, wait a minute, I've been snoozing here for a while because I've been on a cycle for 6 months.
Yeah.
It takes them a while to get going. So use HCG beforehand, not for necessarily any better effectiveness, although I guess you could argue, based upon what I'm saying, it might help you get back to snuff, up to snuff faster. But man, the pituitary signal will be much stronger, let's say, if you do nothing, because there will be no testosterone once you shut off the faucet, obviously, of the exogenous T. These numbers, you know, your LH, your body is still sending a signal with an LH of 6.5, despite your total testosterone of 761 nanograms per deciliter. That's a pretty decent level of luteinizing hormone, saying that, you know, hey, your brain, your body's not happy with that level. It's still sending a strong signal. So maybe it is an issue of your testicles. Just, again, if he's been on steroids for 20 years, what does that mean? I'm hoping that means, I don't mean to say it that way, my guess would mean he's probably 40 years old, roughly, right?
Yeah.
Roughly.
Yeah.
So you're probably a candidate for hormone replacement therapy, or you're at least possibly, right? So again, based on what I said about the numbers, these are just numbers. You're not going to get therapeutic benefit until you get above that 800 nanogram per deciliter mark. And even more important is the free testosterone. We got to get you up there to a higher number. If you started when you were 15, then maybe you crashed the boards, we call it, you know, where yeah, while you were building your HPA axis, you know, like a motherboard, you're putting little things that look like Lego chips on there, and it just blew everything. Then maybe you'll never get back to normal. I hate to say never, but you know, it'll be a lot more difficult to, just like a girl who goes on birth control at age 25 and then stops at age 35. Boom, within a month to 3 months, she can get pregnant again because the body just says, okay, no more of that anymore. I'll get back to normal. If you never got to normal because you started using this stuff during developmental years, which is roughly up until you're 26, then maybe going off, you won't ever snap back to that normal, just like, you know, the birth control example. So maybe it requires a little bit better understanding of, you know, what the right level of TRT is, and everybody's different, and who cares? Right. If you got to use TRT, let's find the level that makes you feel better,
right? Okay,
and work better.
Right.
So that would be the first thing. Well, not necessarily the first thing, but one of the things, the estradiol is too high, and that prolactin score does not make sense to me, not at all. So maybe I'm missing something with the numbers there, but if your prolactin is too high, you're going to have an issue as well. So I hope those three things are helpful. And of course, don't be afraid to make sure that you're you know, getting your nitric oxide levels up. A lot of what bodybuilders, and I'm not picking on bodybuilders, but consider cardio, is doing what I call LSD, long slow distance on the treadmill, where you can sit there for an hour, and if you had all day, you could be there all day just chatting to your neighbor. In order to get NOS going, you know, nitric oxide synthase from the vascular wall, the endothelial wall going, you gotta pump out. It doesn't have to be for a long time. It can be 20 minutes of just, hey, I'm not talking to my neighbor because I can't. I'm breathing hard. You're activating that nitric oxide. Just having that open up the blood vessels in the penis, which is that where that nitric oxide synthase is mainly, and or best. That's the best one for the penis. Even that can be helpful. So I'm throwing everything I can out at this one, but there's a lot of things that you can do before you just throw up. I know you're not throwing up your hands and saying I quit, but you got some things to do before you can say, well, I got a real problem here.
Awesome.